I am here with Gerald Commissiong. He is the CEO of Amarantus, and he has a lot of projects that we're going to talk about today. Gerald, it's so nice to have you here.
Nice to see you as well. Very nice to meet you.
So, Gerald, I would like to first focus on your Parkinson's drug. Can you tell us a little bit about that?
Sure. This is a drug called eltoprazine. It was acquired through a third-party transaction from AbbVie, so that's how we got it. It's got a tremendous safety profile, having treated over 600 patients for up to 2 years at therapeutic levels, up to 8 times what we think is going to be relevant. And now we're moving it into phase 2B for Parkinson's disease. The phase 2A study, which was funded by the Michael J. Fox Foundation, yielded some very positive results, so we're excited about the phase 2B.
That's very cool. And how did you get through that phase 2?
So we in-licensed the product from a company called Psychogenics. They had worked together with the Fox Foundation, and through a close connection of the companies, Dr. David Lowe, they pulled it in because they realized the portfolio of Amarantus together made a lot more sense to have that asset in it and was valuable for them.
Okay, and this drug, is this a pill form?
Yes, it's going to be a pill.
And what other things could it possibly treat?
So we already have data in the area of adult ADHD. And AbbVie, via Solvay acquisition, they did a lot of work in the area of aggression. So they did work in Alzheimer's aggression, and that's another area that this could potentially be valuable.
That's very cool. Now, are you working on any other projects?
We have 3 other divisions. So the eltoprazine asset is sitting in a wholly owned subsidiary of Amarantus called Elto Pharma, and we're preparing to raise capital and spin that off via a go-public transaction, probably an IPO later this year. We have 3 other sets of assets. We have a regenerative skin asset where we can grow skin from a patient, and we use that primarily to treat pediatric severe burns. So this was developed at the Shriners Hospital, and this has been used to treat over 150 patients with burns up to 95% so far. And it was done in a hospital laboratory setting. Now we're moving it over into a commercial setting, and that's primarily what we've done, and we're preparing to launch into pivotal trials for that in a separate subsidiary called Ketanogen, which itself will be also going public. Besides that, we have 2 other subs, one called MAMP Therapeutics, which is developing our co-founders' discovery to treat blindness associated with a variety of disorders, retinitis pigmentosa, retinal artery occlusion, glaucoma, as well as we just reacquired rights to a blood test for Alzheimer's disease that we were developing called Limpro, and we're going to be taking that forward.
Wow, that sounds like some really cool projects that you have in your hands. That's awesome that you can juggle that around. Now, what's your favorite one that's on board for next year?
Well, people ask me that all the time, and each one, there's a reason why we bought it, because we think it's going to work in a very narrow area and it could lead to much bigger things. But I think right now, the focus on eltoprazine, we just got an independent valuation back on eltoprazine. It was very valuable, many, many times higher than our market cap. So as we now work to take that public, we're going to be really relying on that as we capitalize the company.
I look forward to watching that. Gerald, it is so nice to meet you, and thanks for sharing that with our viewers.
Thank you very much. I appreciate it.